Hi, everyone. Thank you so much for joining today's presentation. We are now live, and I will hand it over to Katie Kelly to kick us off. Katie?
Thank you, Chanel. Good morning or good afternoon for those on the East Coast. I'm pleased that you're joining us today for this webinar. The topic of today's webinar is, sorry, and I've lost my place here already, is supporting parent leadership efforts with parent compensation. So we're glad you could be here for this topic, which is part of an ongoing series on parent and family leadership. My name is Katie Kelly, and I serve as the Director of Communications and Community Initiatives for the Pritzker Family Foundation. As many of you know, our Pritzker Children's Initiative is focused on assuring that every child has equitable access to high-quality services and supports, beginning prenatally up to the age of 3, which then help them be successful in school and in life. Today, we're joined by a stellar group of experts from our partners at the Early Childhood Investment Corporation and the Parent Engagement Group. We're delighted to have them lead this discussion, and you'll hear from them momentarily. Before we go into the presentations, I want to give you a heads up that this webinar is being recorded, and as is our practice, we'll be sharing the recording and presentation after the call. Chanel mentioned to me that there's the ability today to download the presentation, and you can see those instructions in the chat. Please do use the chat to introduce yourself. Let us know of any problems in the presentation, if there's any audio or video problems. Share any resources and add any comments. But we do ask that you share questions through the Ask a Question chat feature. There will be time at the end of the presentations for those questions. Also, we're excited to share that today we have English and Spanish captioning for the webinar. You'll see the live captioning on your screen that should appear right under the video, so right below me right now. You should be able to minimize the captioning if you do not need it. So without further ado, let's get started. I'll turn it over to Natalia Carvalho Pinto, the Director of Equity and Leadership at the Early Childhood Investment Corporation, who will be serving as our moderator today. Natalia, over to you.
Hello and hola y bienvenidos a todos y muchas gracias por acompañarnos. Subtítulos automáticos en español están disponibles hoy durante todo el webinar y pueden encontrar las instrucciones y cómo usarlo o deactivarlo en el chat. Hi again, everybody. My name is Natalia, as Katie mentioned, and I serve as Director for Equity and Leadership at the Early Childhood Investment Corporation, or ECIC, where we're working to launch the National Center for Family and Parent Leadership, a new initiative made possible through the incredible support of our friends at the Pritzker Children's Initiative. Our main goal at the National Center for Family and Parent Leadership is to build the awareness, knowledge, understanding, and skills of early childhood systems on how to embed equity-focused family and parent leadership as their new way of operating. Now, as some of you attending today might know, in November, we held a roundtable conversation where we presented a framework for how to center and be intentional about equity when bringing parents to the table to authentically advise, collaborate, and co-lead efforts. Throughout and after that webinar, we received several questions about parent payments, and they ranged from, should we pay parents and why? We have parents who volunteer with us already. Can we pay them? Is it allowable? Is it an allowable expense? And what are some best practices around it? So several questions, and we wanted to follow up on those questions today. And full disclosure, we can't address everything during our short time today. However, we are hoping that this webinar will help you gain some insight and general recommendations from our experts here in Michigan who have been asking and addressing these questions for quite some time. And because this work is and should always be centered in community, and we know from experience that we need teams of advocates, parents, and supporters to implement system change and equitable practices. We are once again going to do this as a roundtable discussion with these three incredible humans who you see on your screen and who have a range of experience guiding policies and implementing best practices, and who can provide some advice to some of you who might just be starting. More about the people you see in this virtual room today can be found in the handout containing their bios, which is provided to you in the chat. But to get us started, I'm going to ask each of our panelists to introduce themselves, including their name, role, and then in one sentence, tell us why do each one of you believe it's important to include families in the work of changing systems. So Chandra, can we start with you? Would you introduce yourself?
Hello, my name is Chandra Jones. I'm parent leader and owner of the Parent Engagement Group, LLC. And I believe families recognize precisely where barriers exist, and they can identify where inequitable practices affect access to services.
Okay, thank you, Chandra. Joan, would you go next?
Hello, everyone. I'm Joan Blau. My current role is as the Senior Director of the Child Care Innovation Fund at the Early Childhood Investment Corporation. And I believe it's essential to include families for many reasons, but the one that I'll share at the start here is that families hold a unique and incredibly valuable perspective on how your system's mission, visions, policies, funding, programming actually works on the ground from their experience. Only they as parents actually understand that because in essence, they're the only folks who actually use the thing you've designed for them.
Thank you, Joan. Kelly, would you introduce yourself as well, please?
Hi, everyone. My name is Kelly Kreider, and I am the Program Compliance Officer at ECIC. And I think if we truly are interested in making changes to our systems, then we need the perspective of the families and their experiences in order to make that happen.
Thank you. And thank you, the three of you, so much for being here today. So for the next 35 to 40 minutes, I'm going to ask each of our roundtable panelists a few questions in hopes to provide you with advice to build buy-in and to build your own best practices to compensate parents for their expertise. After that, we'll take a few questions from the chat. So please use that Q&A space to ask anything you might need, and we'll do our best to get to as many questions as we can. Now, in addition to these three great panelists you just heard introduce themselves, you also hear a little bit from Jacob Pinney-Johnson in the chat. Jacob serves as a parent leadership consultant here at the Early Childhood Investment Corporation, and even though you will not see him on your screen today or hear from him on the panel, he will be available in the chat to address some of your questions and share resources as we hear from the panelists. And if after all of this, we still can't get to all of your questions today, I will send a follow-up FAQ handout with answers to the questions you asked and that might have gone unanswered. And this will go out to all participants following the webinar. Finally, you will hear all of us use the words family and parents interchangeably today. We recognize that families take many forms, and when we use the word parent, it means anyone in a caregiving role. So with this, I'd like to start a conversation with Kelly Kreider, who, as you heard, currently serves as a Program Compliance Officer at ECIC. And I'm going to start with a big question that I get a lot. I hear a lot. So is parent payments allowable? Can we do it without getting into trouble with funders, grantors, agencies?
The short answer is yes.
Well, thank you, Kelly. So now that we got that out of the way, I'm going to circle back to you in just a few minutes for us to talk a little bit more about when it's allowable, but and what are some compliance considerations. But first, I want to turn it over to Joan Blau to share a little more about our efforts over time in Michigan and how parent leadership evolved to also include parent payments and reimbursements as best practice. So Joan, You have worked for over 30 years to authentically and fully embed families and parent leaders into early childhood systems. And I know that a huge part of your advocacy included codifying pay practices into policy to address barriers to participation and really provide equitable access to the table for families and parents who are receiving early childhood services. And as you mentioned in your introduction, can therefore share their expertise as system users. I know it's been a long road, and so I'm wondering if you could please spend a few minutes telling us a little bit about the history of parent payments in Michigan's early childhood system, but specifically two things. One, what has been the argument for providing parents a stipend to share their expertise and receiving appropriate reimbursement for their costs? And also, second part to that, what were some of the steps and considerations you and your colleagues took to develop best pay practices?
Thanks, Natalia. This is, as Natalia said, been something I've actually worked on my entire career. I was really fortunate enough to come out of graduate school and come right into an innovative project where I had a parent partner from the very beginning. So I'll be honest, I've actually never considered doing my work without families, which I hope is a vision we can all still hold going forward. As Natalia said, it's a long road, but we have indeed made a lot of progress. We were helped in our early efforts in Michigan, which actually began in the 1990s, by a few things. One was federal legislation that was coming out of maternal and child health and children's special health care services in particular. There was brand new federal legislation about creating early intervention systems that were inclusive of families and based on family-centered practices. And there was a lot of work happening in the mental health system around creating systems of care. All of those things were in reaction to the kind of fragmentation that families were experiencing and trying to navigate. And so one of the things that was very helpful to us in making the case in the beginning is we see these differential outcomes that we have for children and families, particularly Black and Brown children, children with disabilities, children with special health care needs. And we have reached the limits of our own knowledge and understanding. And we are missing some incredibly important perspectives, like what I referenced in my introduction, which essentially we'd created our own blind spot. By not having families at the table, we couldn't really understand what their experiences were like with the things that we were designing and putting out into the space. This federal legislation and funding helped us create like a practice field, a playing field where we could try some things out by working together with families to do that. Another thing that we were really trying to put the kibosh on, which unfortunately I think still occurs, is this kind of doom loop around parent blaming, where when I'm out in community and I'm working with different coalitions and collaboratives or state government, what I often hear is a lot of parent blaming going on, like, we create all these amazing services, how come families don't use them? Or why is it that only certain families use them? And then people sit in meetings and try to decide that without parents there to really understand what's going on. And so one of the things that we were really advocating for is let's stop wasting money on solutions that don't include parent co-creation and parent voice. And instead, let's solve the right problems the first time around instead of guessing what problems we should solve. The other thing that we were really using, two other things that we really used as our rationale was that those of us that work in the systems and that are professionally trained in many different disciplines, we're taught certain kinds of mindsets, values, beliefs, ways of doing things, practices, best things that are promoted to us over time. Many of those are very valuable, but they often can box us in. We only have a particular way to understand a situation. And so what we were experiencing in the work we were doing was how incredibly creative families could be without those constrictions. They could suggest very common sense solutions, very oftentimes things that didn't necessarily even cost more money. They just worked so much better from the family perspective than what we had designed. So we were able to make some progress using that rationale. And then really the last thing that we were using to spread these kind of payment practices throughout our state government into our local communities at many different levels was that everyone else that's sitting at these collaborative tables is compensated for their time and their expertise. And that we were essentially asking families to pay for the privilege of sitting at the table to give the system advice. And we really wanted to flip the script on that and to assure that we were creating opportunities for all families from all walks of life to not face financial challenges, to actually being able to shape policy and programming that better suited them and their communities. Related to steps and considerations for best pay practices, I would say that fundamentally we were committed to having no family experience any out-of-pocket costs to be able to actually sit at a collaborative table or to help provide a training or to give a keynote presentation or any of the things that we're typically asking families to do. So that was one of our bottom line principles. How do we design payment practices so there are no out-of-pocket costs? We know that we need to be really clear from the very beginning with what we're doing, to have clear expectations and a commitment to supporting every family's success. Chandra knows, I know, having worked with her for many years, that families come to these opportunities with many different kinds of experiences, and supporting people's individual success doesn't look the same for everyone. So while you want to have robust and comprehensive and transparent payment practices, you also have to have flexibility, because some families, for example, have extraordinarily expensive childcare businesses because their children might need the care of a nurse, or they might need a very hands-on person along with a babysitter to manage multiple children. So when you're setting your childcare policies, for example, you want to be thinking about, how do we create space so that even families with the most extraordinary childcare needs can still have the opportunity to be here? We thought a lot about transportation and the fact that many families that we wanted to engage did not own their own private vehicle. And so how do you support transportation under those conditions? And we've done some pretty innovative things over the years at the Investment Corporation in order to make that happen. Timeliness is critical. Not every family can wait to get their money after they have helped you with their incredible advice. Some people actually need to receive their funding up front to even be able to come to a meeting, to afford to travel, to afford to sit at your table. So your payment practices ideally can be really informed by that understanding that you've got to think very differently than you might about a private consultant that you've traditionally worked with. Something that's crucial is understanding what are typically called benefit cliffs. Many families become eligible for services that are important to supporting them because of their income. And so depending on how involved they might become with your work, your payments to them could affect their income. And so you need to counsel families as they're coming to the table to help them make the best decisions for their families. I think the last thing I would say here is that we always had a dual capacity building mindset here. So while we're talking about payment practices, the other thing that we were really thinking about is, how do we make sure that as we're bringing families to the table and we're bringing them together with leaders and folks that are working across systems, that we're thinking about how are we building the capacity in both families and others to really embrace and take full advantage of the consultation and expertise that families provide, and to teach people how to co-create together. that is a fundamental reason why you are having these payment practices, is because you're trying to really dig into those differential outcomes, those services that your families aren't using, those places where you've reached those roadblocks. And to do that, everyone at the table is going to have to think differently and work differently than they have in the past.
Wow. Thank you. This is great. Thank you so much for sharing all of that. I think it's so many considerations, right? And I think it's so important to talk about this work along a trajectory. I know that what you shared here, Joan, was 30 years worth of work, right? And in thinking through, and so those of you are attending are getting, snippets of all of the considerations that were done along this trajectory, because changing systems, if we're honest, and implementing sustainable practices is done over time and through consistent, advocacy, engagement, and best practices considerations, and a lot of trials and errors. And you really exemplified this, Joan. So I appreciate you sharing some of these things to think about. Now, Chandra, after hearing from Joan, I just wanted to follow up with you as well. I know we've had this conversation before, and I know that many system leaders struggle with this and with building buy-in around parent leader payments, because there's still sometimes a feeling that parents need to volunteer for the things that they're passionate about, right? If this is about their children and they're receiving services, they should want to do it. So in your experience as a parent leader, right, how have you decided when to volunteer and when to maybe pass up opportunities that didn't, at the very least, offer reimbursement for your time and your expenses? And, second part, from your perspective, how do you think this could limit yours or other parent leaders' opportunities to engage?
So in my earlier years of being involved as a parent, I would say yes to almost everything. If my schedule would accommodate it, I would always say yes. And the reason I would say yes is because I cared. I wanted to be a part and be able to make a difference, not just for my child, but for others. However, I really didn't think about my resources or lack thereof. My thinking was, well, as long as it doesn't cost me anything, I can participate. But the reality is that there's always a cost. And so this is a more local situation. I was receiving respite, and I would use my respite care to go and attend a meeting about how to improve, because they wanted parents to be able to be there. And it was all because I cared. However, caring didn't fill up my gas tank. I was using my resources and the resources that I was receiving from the services to pay to be able to attend a meeting, because I wasn't being compensated. I wasn't being compensated at that time. So it just helped me over the years to say, you know what, if I'm not being reimbursed, if it's actually taken away from my family, then how can I be able to support? Because I'm losing something. And once I had that realization, it helped me to be more decisive about things that I chose to be involved in, because I had to think, okay, what are they saying? Does it line up with my values? And also, am I being valued by being offered compensation and reimbursement, not using my respite, I was in a mom's club and not bartering with the other parents. Well, they can watch my kids so I can go to a meeting, versus me being able to use that time to run errands or do something else with another family member.
Thank you. It's an important perspective too. Now, Joan, I'm switching back to you as well. And thank you, Chandra, for sharing your story a little bit. John, amongst the many hats that you wear under your role at the Child Care Innovation Fund, you're also working with the Michigan Department of Education on this comprehensive statewide effort to increase the number of licensed child care programs across the state. And a part of that includes a child care regional planning grants. Now, I know that to maximize the impact of these planning grants, coalitions are being asked to involve parents in all stages of their planning and compensate them for their time and work. And our teams are working together to provide some guidance to coalitions that are part of the Child Care Regional Planning Grants. But can you share specifically from your perspective and experience, what are some key recommendations and advice you have for, these coalitions we're currently working with, and for anybody who's looking to codify pay practices for their family and parent leadership efforts?
Such a great question. And the Early Childhood Investment Corporation has been working on this issue for many years. So I would say that you need to seek counsel and co-create your payment practices to the degree feasible with parent leaders from the beginning. And that what we often have in community is unrecognized or unacknowledged parent leadership because it's happening through, for example, community-based organizations or more informal groups like Chandra was talking about. But I guarantee there are parent leaders in your community that are gathering together in a variety of ways to make change. And they are in the best position to advise you on some of the basic things that they're going to need to be successful, to be able to attend your meetings ideally help to be prepared for the opportunity because there's pre-meetings and pre-materials. They know what's going to happen at the meetings. There's some debriefing, and that all of those things are recognized as a part of your compensation. So there's a real clarity of expectations that's kind of co-created. We embedded that into our request for proposals for these regional coalitions. We scored people's grants and budgets based on their inclusion of families and that they were using proper payment practices. We provided some guidance and advice associated with that. The best mindset to get into is that I have yet to work with an organization that doesn't hire consultants. So we know how to hire consultants. Parents are consultants. That is what you are asking them to do. So fundamentally, with your procurement folks, your budget office folks, you're creating a set of policies that's customized to a particular kind of consultant, which are parents. And you can apply many of the same practices that you would apply, which is you are valuing their expertise. You're making sure that you're considering the things that enable them to get there. And of course, there's some special things that are associated with including families in order to assure no out-of-pocket costs. The other thing that we really think about when we're talking about embedding is that we want people to think broadly enough in their payment practices to also include things like access to technology that allows for equitable participation in meetings like this. We know that many families have to participate right now using their smartphones when they're engaged in things. That is not ideal for an online meeting in an ongoing way. So we supported these regional coalitions to include technology for parents, laptops, iPads, notebooks, digital notebooks, so that they can engage in meetings equitably with others, that they have the same kind of access that we're providing for others. The other thing to think about is what is the best organization in your community to process these payments for families? Because timeliness is so critical. It's a service that the investment corporation offers. You may have others in your community that offer those kinds of services for one reason or another. So I wouldn't necessarily make an assumption per se without further investigation of what's the best place for us to cite this reimbursement in our collaborative systems effort. Who is in the best position as an organization? And it may be a family-run organization, which there are in communities, that is in the best position to do this. And I think the last thing I would say is that this is an ongoing iterative process. And so how are you learning directly from families how things are working? By asking them and listening and then incorporating that feedback to improve your payment practices. What ECIC does today does not look the same as what we did when we opened our doors and hired our first parent to work for us and then worked with families across the state of Michigan for many, many years. We learned from them and we've kept improving what we're doing.
Thank you. And Chandra, you and I have talked about that too, right? About how you provided some advice around, parent payments from a parent leader perspective. And so given your perspective and given your many years of serving as a parent leader and also training other parent leaders, do you have any other advice to add to what Joan just said?
Yes, that we have to look at it as an investment because the expertise that parents have, no one else has. And compensating parents is an investment which does give a return. Everybody wants a return on their investment. And so the data that's used that is given from the customers, which will be the parents, can be used to develop a strategy that would improve services. I mean, that's what businesses do. They ask the customer, what can we do? And depending on how they're being asked, they give a perk, they give some incentive to be able to get the input from the customer to improve their services.
Okay, thank you. And finally, I have one last question for both of you, Joan and Chandra, before I turn it over to Kelly again. I'm so glad you touched on the investment piece. So in speaking of looking at parent leadership as an investment, and to folks attending, let me give you a little background. One question I hear a lot from folks in our early childhood system is, speaking of the investment, how do we set up an honorarium rate? What's an appropriate rate for reimbursement or stipends? And so before we go into that question, I have two flyers, handouts that we are sharing with you that include some advice based on what has historically been practiced across different initiatives in Michigan. And we're dropping them in the chat here and sending them to you via email following today's session. But I also want to provide full disclosure that we don't have a magic formula either for this thus far, right? Joan, as I know you can tell us all here, I'm sure this is a conversation you have been having for over 30 years when doing this work. And it's a conversation that I have found to adjust and adapt based on needs, location, and specific program considerations. So knowing all that, let me start with you, Joan. Knowing that this is a conversation that is still happening, is still top of mind for folks who have been doing this work for a long time, and for folks who are new to bringing family and parent leadership to the table, based on your experience and what you know, what is your best advice to system leaders for setting a rate for honorarium and reimbursements if they're able to do so?
I think what we're seeing across the country, and I know what's on the table in Michigan, is really moving away from this idea of a rate to rates and to a more differentiated understanding of what it is that we're asking people to do. So, for example, on my advisory committee for the Child Care Innovation Fund, I have parents. And in recruiting those parents, we laid out very clearly, this is expectations. These are the things we'll pay for. This is our hourly rate. This is what all this looks like. And those rates that we provided for what we're compensating families and our expectations were a part of what made people want to join the committee and be a part of our efforts, because they could see, as Chandra was talking about, like, we value every minute of your time that you are giving to us. If you are reading our meeting materials, we're going to pay you this much. If you're coming to our meetings, that's what this looks like. We're happy to debrief with you at any time. We'll compensate you for that time. These same parents review grants. They're paid for that time. So we're not asking people to do something ever really that we're not valuing. And our rates reflect that, because so often we aren't just asking people to say, like, come and sit at a meeting. We're not saying come and sit at a meeting, which I think too often is kind of how people think about this. We're saying, we know you'll be doing things to be an active member. We know you'll be preparing comments. We know you're going to want to understand where you can add into the agenda. So we want our rates to reflect that. I think the other reality is that we need to value family consultation equitably with the other kinds of system compensation that we seek. So I would say, look at how you're valuing other consultants, look how you're valuing their expertise, and map on in consultation with families. And I think that you will find that you will want to, in all likelihood, increase what you're often giving people as an honorarium, because typically, in my experience, parents tend to be the most undervalued consultants that we're working with, even though they are literally the only people that can tell us what it is like to experience the systems that we're designing, and are in the most unique key perspective to be able to actually help us fix those problems that we perpetually have with outreach, with access, with uptake of services. Those are all reflections. So you're struggling with those, you need families to help you fix those problems, because they're the only ones that have the insight that you need to do that.
Thank you. And Chandra, you and I have had this conversation before, and Joan mentioned it, during her last two answers. But you've also talked to me about how at some of the councils and advisory boards you've been a part of, parent leaders helped revise and update rates as well for their participation, collaborative efforts, or advising. So, Chandra, based on what you have observed through these boards and committees you've been a part of, what, in your opinion, are some considerations for updating rates, or any other advice that you may have to add to what Joan said?
Yes. Well, because of the work that Joan and Parent Partner did over 12 or more years prior to me becoming involved at the state level, parent reimbursement was already established. So when I came along, we were at the point of, let's revisit what rate is still, what still seems right. And the parents helped to establish that. So every 2 years, we would review the rates to see what was reflective of the current times that we're in, as well as the current work that needed to be done. And parents were part of that process to say, yes, we think it is time for an increase, in that it should be this much. And the parents that were a part of the group at that particular moment in time are the ones to help decide that.
Okay. Thank you both so much. I really appreciate this conversation. And now I want to switch gears to Kelly again, to share with us, in addition to advice that you heard from Joan and Chandra around some best practices considerations, what some considerations from procurement and compliance standpoint might be. So Kelly, as you mentioned earlier, providing payments for parents for their time and expenses is allowable. Now, when is it allowable, and what are a few primary or key factors systems should consider from a procurement grant standpoint for paying their parent leaders?
Sure, Natalia. So as Joan mentioned really succinctly, parents are consultants. So a lot of the cost principles that you would consider when making other purchases or contracting with people are quite similar. And the few that I really key in on when we're talking about federal funds and thinking about uniform grant guidance cost principles, the first is really necessary and reasonable for performance of a federal award. So if paying parent leaders is part of your work, then key factors there are writing that into your scope of work so it's documented and that it's in your budget. And to be sure you're considering market prices. So again, this conversation we're just having about setting rates when you're establishing that and documenting how you arrived at those rates, however that may be, gives you that extra backup documentation for how you came to that decision. The second cost principle to consider is adequately documented. So anybody who's in the finance or compliance space really knows documentation is so critical. So like any other expense you will have or incur, ensuring you have that proper documentation is for each of your payments is equally as critical. And that can look different in in many ways as long as you have it documented. And then for something else you would want to consider, in my opinion, is if it's possible or beneficial to include something to this effect in your organization's financial policies or procedures. That can serve as additional guidance, not only to you and your colleagues for how to implement, but also, again, supporting documentation. For us, our board approves our policies and procedures, so we know we've got a good line for that it's been reviewed and we're meeting all of the requirements. And it allows us that extra guidance as well. The third principle to consider is written approval from the awarding agency. And I think this is especially true if paying parent leaders is new to you or new to existing work that you've had established. So having that approval documented then supports your scope of work and your budget, and we kind of check all those boxes along the way. When we're thinking about private or philanthropic grants or funding, some of the same general principles really apply. Even though these funds are typically more flexible, we still want to honor those factors, including parent payments in your scope of work and budget helps your funders know where you are using those funds wisely to support the work. And again, adequately documenting your expenses. And then lastly, thinking about things from an accounts payable perspective, tracking those expenditures so income can be appropriately recorded and 1099s issued. I think I've seen a little bit of something in the comments about, the $600 threshold. That's absolutely something that is critical to pay attention to. So you're not upfront, so you're not having to backtrack on that later in the year.
Thank you, Kelly. I know it's so important to have these considerations around allowance and how to use funds appropriately. And before I go to our next question, I'm seeing a question in the chat speaking to this accounts payable piece and the $600 piece. And I know this is something that you and I have talked about it in the past. So little out of order, but can I ask a quick question from the chat while we're on the topic? And that is, are parents required to provide a social security number in order to be compensated? And, can we speak to that real quick before we move on?
Absolutely. And it is an important question. And we have had a lot of conversation about it. Transparently, I'm not a tax professional. So, but what I understand is if you are hitting that $600 threshold that meets the IRS requirement for reporting income, then we do need to collect a social security number because that allows the organization to report that as income as required by the IRS. So Natalia, I know you probably have other great guidance to provide around that when that's been a challenge.
Yep. So yeah, as a one-time only, under 599, right? We can continue to provide the payment. So thank you. And so this is great advice. And so I'm thinking, besides all of this, I'm also wondering, based on your experience, Kelly, what's some other advice or lessons learned, right? I know you've been doing this work for a long time as well. And what are some lessons learned that you can share with other system folks who are starting to actively engage parent leaders and make considerations for payments?
Lots of lessons learned, but two big ones that stood out to me when I was thinking about this. And the first, Joan and Chandra have touched on this and really thinking about establishing things early on. So determining who will be paid, what they will be paid for, when payments will be made, and how those payments will be made. A lot of that takes some really deep thinking about processes, about documenting, and doing some test runs. So are your rates similar to state or other organizations? How are your current accounting practices able to accommodate parent leaders as vendors? It, in some ways, seems like an easy question to answer, but really oftentimes it's takes a lot of deep thinking, have a lot of people at the table within your organization to figure out how to actually, how the sausage is made. So, and then the second lesson learned is don't jump to gift cards as the first solution. I know it seems like the easiest thing, especially now that e-gift cards are so easily accessible and sendable. But there's several reasons why I would encourage you to think outside of that box. The first is it's an equity issue. The goal is to compensate parent leaders, as we've been talking about, and we don't compensate others in the form of a gift card. I loved Chandra's quote about caring doesn't pay or fill the gas tank. Gift card can't pay your mortgage or your rent. Gift cards are really hard to track and can pose a liability, especially the physical cards. If they go unused and they're, traveling between your coworkers or your programs. So there's a liability there. There's also usually a fee when you purchase them. So it in some ways a little less cost effective. We want all the money that is set aside or budgeted to go to parent leaders to go to parent leaders. And lastly, gift cards also have to be reported as income. I think that's something that not everybody knows. So, and it follows the same methodology. If you're receiving gift cards in the amount over $600, it does still have to be reported as income. So I would add, you might consider this as an option if it's a specific request or on an as-needed basis. I know Natalia and I have worked through a few things where it was a one-off or a one-time circumstance, but really that's like a last resort for us. So.
Thank you. Some great advice. And I know there's lots of questions in the chat. So real quick to wrap us up, so we have a few minutes to spend, doing a few of those questions. Finally, like here at ECIC, we have also developed an internal process, right, for processing payments for parents. Joel mentioned how important it is to have processing practices, right, to allow for timely reimbursements. And I know this is a little bit outside of your area, Kelly, but you've also been involved in an integral part of helping us build some of these processes. So what might be any additional advice that you have to ensure parent payments are processed smoothly within an organization?
Yeah, so you will have a team. Hopefully you'll have a team of more than one who is supporting you and supporting the process, but is identifying one person to answer questions from parents and to send those payment requests has been incredibly helpful. It helps cut down on a lot of miscommunication, and it helps keep things moving quickly so that we can support parents as best as possible. Also, create a parent payment form. This, again, keeps things really clean and consistent, helps with your documentation, and also lets you capture how parents prefer to be paid. So paper check or direct deposit, and how to contact them if there's an issue. Again, if we're thinking about timely payments, that information up front is really critical, especially for your finance or your accounting team.
Okay, thank you. So I wanted to thank so much our panelists for your time today. I really appreciate you being here and fielding through. These were some questions that I have been getting for months. So that's how we came up with those questions. We're gonna go into the chat for a little bit. But before I do that, just so you know, a handout with resources is available in the chat and will be sent to all attendees via email today as well after today. We'll also we'll send all participants a follow-up that includes any resources we cited today, and questions from the chat that might not get answered during our sharp hour. So thank you for taking your time to be with us today, and we'll follow up if there's still lingering questions. But if it's okay, I'm gonna take one question I'm seeing pop up a lot on the chat. If we have a few minutes to answer that, is folks are asking for examples of maybe initiatives where systems and parents worked in collaboration to pay parents. And so any examples, Chandra, that you have, or Joan, that you have where there's a particular initiative where a parent and system co-created your parent payment structures? Chandra, let me start with you. Do you have anything specific you can share? And then Joan, if you can share an example too. If you can think
Well,
of
something
it.
I'm thinking about when we revisited what the rates, what parents should be paid, we looked at things, meaning parents, we looked at, well, how often do raises occur within the state? What increments are they occurring? We looked at things like that. Also, inflation or things. There was even a situation few years back where there was issues within the state, and so we elected as parents not to increase what we were being paid, because there was also a hole even with state employees, and that was a choice that as parents we made to say, okay, we're going to hold off, we're going to keep everything where it's at right now. And then instead of 2 years, we looked at it again in a year when things changed to say, okay, now do we think this is still an equitable amount for parents to be reimbursed?
Thank you.
I would say that the Early Childhood Investment Corporation actually co-created our payment practices with parents, because we've had parent employees and worked with parent consultants since prior to and since our founding. And so I think that's an example of an initiative. We're a statewide organization that works in a variety of the early childhood sectors. We also, as an organization, worked with all of the intermediate school districts across the state of Michigan for many years, and helped them to host collaboratives in a specific coalition devoted to parents of young children. And we worked with the intermediate school districts, and we worked with the coalitions to help figure out exactly how to support families in their areas. So we provide a lot of consultation. In Michigan, we also have something called Parents Partnering for Change, which is a cross-agency funded leadership initiative, policy leadership initiative for families, and the payment processes for families who participate in that was co-created. It's actually co-trained by parents and professionals, and they have co-created practices. So I could list many things. I think that's one of the advantages of how we've done the work in Michigan. We kind of started with the State Agency of Education because we had the early intervention legislation. We also worked in our Department of Health and our mental health system. And then those leaders and individuals worked together to bring those processes and approaches into initiatives that they were helping to fund and operate in communities across the state. And so we've got a long history that we're building on, but I think the more that we can recognize, like, there's lots of support in federal legislation in particular for this work, and mostly with private foundations, I've always found an openness. So perhaps it's like, how are our state practices becoming more and more adjusted? And we're starting to see that happening in other states. So I think there's a lot to build on in terms of examples of initiatives where this has happened.
Okay, thank you. And so what I'll commit to doing is putting together a couple of links and examples on this FAQ that I send out to all of you so that you can also look it up based on some of what Joan just shared. So I think we have time for one last question. And I like this question. This got asked in the chat several times. So can you share a bit more detail about how you support families when they come up against the benefits cliff, right? What options are you able to provide families so they can continue to participate without losing benefits? Chandra, again, I know this is a conversation we've had in the past, and given, you know, your experience as a parent leaders and advising other parents, mentoring other parents, do you have any advice around that? And then I'll see if Kelly or Joan can add.
From my own experience, I like to be able to have that choice to decide, to be well informed, to know that, okay, anything above $5.99, I'm going to receive a $10.99 for, or my child is receiving disability benefits and it's going to affect my income. But to be able to be offered that choice and given that information, and then I can decide as the parent which route I should choose, that nobody is taking that from me, that I can decide, well, you know what, this may cut my benefits back this month, and next month I may or may not have a means, but that I have a choice to decide. I'm being informed so that I can make that choice.
Thank you. I appreciate that. And I know we're pretty much at time. Do you have any, Kelly or Joan, any like last minute, last quick thing to add to what Chandra just said?
I would just say, hopefully it's also an encouragement to involve a lot of families, because one way you can manage that is like not putting the full burden onto one parent or just a couple of parents, but really thinking more broadly about who you're engaging to spread out your leadership investments in a way that doesn't impact families' overall benefits.
Thank you. That's such good advice. So I do need to hand it off to Katie to close us, but we'll follow up after today if there's other things that the presentation didn't address.
Thank you, Natalia. I want to extend heartfelt thank you to you and our other presenters today for sharing their experience. I learned so much, and there's so many questions that I know we've left unanswered that we will follow up with everyone on and continue to draw expertise from this group. So we will share that information. We'll share the slides, the recording for today. You'll see that email in the coming days, and please pass this along to your colleagues and network. Before we close out, I want to encourage all of you to join the NCIT Exchange, which is a great platform to share resources and opportunities on an ongoing basis. You can learn about events and webinars, other resources that'll help you on this topic and other topics as you move forward your goals. And our team is posting that link in the chat. Also watch your inboxes for invitations for upcoming webinars from the Pritzker Children's Initiative, as well as our partners at the National Collaborative for Infants and Toddlers and the Prenatal to 3 Capacity Building Hub. All of us are trying to provide you the best information to help meet your goals, and we want to make sure you see those opportunities and can take advantage of them. In particular, I want to call your attention to 2 additional webinars on this topic of family engagement that we'd like to make sure are on your calendars. First of all, on February 21st, there is a webinar about joining the National Cohort on Parent and Family Leadership that will give you information about how to apply, answer your questions. And then also in May, in spring, when we'll all feel warmer than we are today, and maybe there'll be sun, there'll be a webinar on moving your family parent leadership efforts towards equitability. So that'll be on May 11th, and you will, of course, receive invitations closer to those dates. Finally, we know that feedback's a gift that we all can give and we'd love to receive. So please fill out the live poll so we can continue to learn what content resonates with you, our audience, as we build out future webinars. Thank you again to our panelists, and thank you all for joining us today. Have a good day.
Thank you.